This is Joe Wilson. I'm the co-founder of the C19 Coalition, a nonprofit formed to help address the COVID-19 crisis, specifically the PPE crisis that began in the spring of this year. I'm joined today by Olivia Troye. Olivia started her career in Washington, working at the National Counterterrorism Center, the Department of Energy's Office of Intelligence, and the Office of Intelligence and Analysis at the Department of Homeland Security. Then Olivia worked in the Vice President's office as the Homeland Security and Counterterrorism Advisor, and most recently served on the White House Coronavirus Task Force through August of this year. Olivia, welcome, and thank you for joining us today.
Thank you. It's great to be here, Joe, and thank you for having me. I'm excited for our conversation. Hopefully a productive conversation. Hopefully I can help shed some light on some things moving forward too.
Absolutely. So let's just jump right in. How did you find yourself, first of all, in the administration, and then most recently on the COVID task force this year?
So I had been a career national security professional. I had been in government for quite some time, I guess almost 2 decades. I've jumped in and out of government, but I've always had roles that were working tangentially with government per se. So I was always involved sort of supporting the national security community, whether I was in or out. And I was at DHS when the Trump administration first was elected into office. I actually started in my assignment at DHS the week before Donald Trump got elected. So I took the role there. And I did not know that the focus would be on the Department of Homeland Security and the way that it became. I was not anticipating working on things like immigration issues or travel and screening and a lot of the executive orders that were issued from the White House. That was certainly a curveball for many of us that moved very fast in the beginning and the administration years. And then after being there, I was there for about 1.5 years, and I was asked if I wanted to, there was a slot in the White House. Originally, there was a slot at the National Security Council. And when you're a career intel officer, you sometimes will serve in the National Security Council in a directorate somewhere. For me, it probably would have been the Directorate of Counterterrorism. And you rotate. The White House has detailed assignments. Detailees is what we're called. Some of you may or may not be familiar with that. So I just kind of lay it out just to explain a little, because it's very much Washington lingo sometimes, the way we talk about it. And this slot came up in the Vice President's office, and it was a detailed assignment to serve as his Homeland Security and Counterterrorism Advisor. And, so I met with them. I interviewed for the role. Look, I went into it eyes wide open, having already been living the Trump administration from DHS, right, from that lens, for 1.5 years. And, I decided it would be an opportunity to try and serve and make a difference. And I'd been in the national security community for quite some time. I had a lot of colleagues across the different various agencies, which I think actually made me more productive and successful in my role, because I had worked with a lot of these main leaders across the intel community, and we worked on a lot of major problems. And so in my role, I covered a lot of the natural disasters, hurricanes response and the fires that were going on in California, tornadoes, flooding. And I also covered issues like mass shootings, which were, for me personally, some of the hardest ones, especially because there was a mass shooting in my hometown while I was in the role in El Paso. And that was really it was a very painful thing for me to have to witness and work on, to know that my own hometown where I'd grown up was really extremely affected by an event like that. And then, moving towards 2020, being the Homeland Advisor, I look at threats coming to the US and the impact on Americans. And, so we started tracking what was going on in Wuhan, and that is what leads me to the White House Coronavirus Task Force, which I served on from day one. I was there since January, before the Vice President actually was leading the task force. I was attending the meetings, and trying to figure out, what was really going on with the CDC and HHS and everyone. We were trying to understand the situation on the ground. So I, served as the lead staffer on it. And then, all of you saw the vice president gets put in charge of it, which makes my role that much harder and more challenging because then I become I become the lead staffer for it and for him and for a lot of the experts on the task force. So I spent a lot of, it was long days and nights with people, I will say some of the experts on there who really had the weight of the world on their shoulders during a crisis that was quickly evolving and it was challenging. And, I think that a lot of them had the best intentions and really tried. And when I say that, I mean, I think of people like Dr. Fauci and Dr. Hahn, the head of the FDA, who I got to know very well, who, it was hard. It's really hard to be in the middle of a crisis like this, especially a pandemic of this magnitude that we had never faced before. And so I think regardless of who would have been in office, it would have been hard because we had never faced kind of the extent of what this was and how quickly it was evolving. And so that was a challenge within itself. I think, I've been very outspoken. I'm sure you're well aware of this, of how things developed along the way. And I have had some very significant views on the way it was handled and mismanaged at times. And I think that there were a lot of things that happened that shouldn't have happened that were critical in how this continued to develop. And, you mentioned PPE and everything before when we were talking, and that was certainly one of the biggest challenges. And I think there were a lot of lessons learned as well about, the United States and where we are in terms of PPE and the fact that we don't manufacture PPE here. When you have an entire world, everyone was looking for masks. Everyone's trying to get a hold of PPE because it's not just the United States and China fighting this pandemic, right? It's universal. And everyone is trying to figure out how they manage their own crisis within their country. And, for us, the masks were mostly produced in China. We didn't produce masks here. And, to stop and think back on that and think about manufacturing and production here, I think is a big lesson, I think, for the US and sort of taking a step back and thinking about in a crisis like this, who do we rely on and how do we move forward on that? And I think it was a big lesson for us knowing that we really had to rely on overseas shipments. We didn't, and also, the creativity, thank goodness, and innovation of domestic production here, if that makes sense. And having manufacturers and different companies say, well, I can do this. I can start making masks. I can shift my production to that, which I think was, thankfully, some of the most amazing stories were that, right? When you have Americans across coming together saying, I'm going to think outside the box and solve this problem and help. And I'm grateful for that, right? And the American spirit that did come together in spite of what we were seeing as, was divisive, unfortunately, rhetoric that really kind of was leading a response that should never have been that way, if that makes sense. So there's my opening segment, so to speak.
No, I appreciate that. And honestly, I think there's, I almost interrupted you about 10 times because there were different things that came up, but hopefully we'll fill in some of those blanks over the course of this conversation. Taking a little bit of a step back and just thinking kind of chronologically, when you were in that room in January, at what point did it move from, oh, this is interesting and probably something to keep an eye out on, to, oh, wow, this is going to be the one in terms of the pandemic that could really hurt the United States?
I think for me, it was probably late January because I had been kind of tracking it. And personally, when I was watching what was happening overseas in Wuhan, and when China starts to build the hospitals, right? I remember that. I think that was, to me, I was thinking to myself, well, one, I have to say, I was thinking to myself, wow, we would never be able to do that here. That's just not how it works here. So if we were in that situation, I don't know what we would do, because they were like building structures from the ground up, which is, amazing, because that's how China does things. But I was thinking to myself, the fact that they are doing this right now says that they know they are in a very severe situation that's out of control there, right? And they can't keep up with it. And then I was thinking about traveling, because, as a homeland and a national security person, I study travel patterns, and I think about screening and vetting and things like that, and globally, and threats, and how all of that kind of comes together. But for me, I was thinking about how many people were traveling to the US from all over the world, and how this virus was likely spreading. And so I kept thinking, there's no way that this virus isn't here, right? There's no way that all of these people have traveled in from China through major airports in our country. And I think the numbers were astronomical when I looked at how many thousands of people a day were coming into San Francisco airport. I kept thinking, it doesn't add up to have an outbreak like that overseas and not have it spread. And then you see it start to spread in the region. And when I saw that, I knew that we were heading down a path, and we had no way to do contact tracing here. And I think that is an issue that is critical. And CDC has actually raised that for many years, is the contact tracing of travelers. And I think when you don't have the ability to really verify someone's contact information, or you can't track people down when you're on a flight, that to me, I was like, so let me get this straight. We have a 200-person flight, and we don't know how to contact half of these people possibly, or we can't verify that we'll be able to call them and say, hey, we just found somebody who just tested positive for this virus, and the 5 people sitting next to them could have been infected with it. And, when you can't contact trace that way, and it's getting more and more increasingly, I think that's a challenge. I think, at the very beginning, if it's smaller numbers and you can do the contact tracing, you can save yourself. I mean, you can pretty much slow the outbreak. But by that point, the fact that we couldn't do that, which remains a problem today, and CDC has fought this, and it's a legislative issue, and it's a lobbying issue. I think then, to me, I worried about it, because I knew that this was going to be an increasing challenge. And, sure enough, it becomes that way. And then it turns into, where it's no longer like sort of containment. It's more of like mitigation. What are we going to do next?
That makes total sense. I think, everyone has their own moment for when they realized the pandemic was going to be extremely serious. I remember for me, I remember watching, you mentioned some of those videos of China building hospitals. I remember when they were spraying down kind of quarantine cities with sanitizing agents. And people were just like, what is that? Like, why are they doing that? And then the second image for me is the Iranian body pits as they were digging those, with kind of those grainy videos that were released. And I think everyone has their own moments for what kind of shook them into, hey, this is not the flu. This is not SARS or MERS that we've seen before. This is a different animal altogether for a lot of reasons. So fast forwarding just a little bit, it's late February, early March. At this point, I think by this point, Vice President Pence had been kind of appointed the head of the task force. During this period, was there ever a time when you said, okay, I think we've got a handle on this? We see the challenges, but we're on it. We've got the teams to address this comprehensively.
I think maybe there was a glimmer of hope in early February, maybe, when I think we were looking at things, and it was sort of, we're going to get access finally on the ground in Wuhan to really understand the virus, because that was a major holdup as well. We kept asking China and WHO for access on the ground, and CDC kept asking. And for the CDC, that's a critical thing. They deploy immediately. They're on the ground. They're in partnership with their allies and scientists and everything. And it's coming together to kind of figure that out. And we wrote letters, and there were phone calls. And I remember they were fighting for access for weeks. this went on for a while. And I think we lost a lot of time there because we were guessing a lot of the time. It was evolving. If there were a lot of unknowns with the virus, we learned along the way that it spread through aerosol. We knew that for sure. We learned that asymptomatic people could be walking around infected with the virus. That was a big thing, I think, a big red flag for us. I remember being very worried when I left that meeting and thinking about what that meant, right? The fact that, and how scary it is to think that someone could be walking around infected and not even know that they're sick and they're spreading it. And to think about that, right? And especially when you start to think about it for yourself and you're like, am I carrying it? Like, who have I given it to already? And I could be killing someone and I don't even know. It's heavy, right? It's this invisible enemy that's all around you. And it's serious. It's a really serious situation to be facing. But I think, in early February, I thought maybe, one, we needed to fix the testing. When the CDC test failed, that was a huge, problem for us. So there were discussions about fixing the testing. There were discussions about PPE and how we're going to get organized on this and what was going to happen. But I'm going to be honest, for the most part, it was chaos. And I think it was so many problems needed to be fixed all at once. And it was so disjointed. And the coordination of it was just chaotic. And at times, we were facing random events internally in the White House that we weren't expecting. One of them being the president, right? And his reaction at times. That it became an increasingly bigger challenge along the way. And I think that was ultimately what leads sort of to the challenges and difficulty of this. Because, for a while, Dr. Birx showed up and I think she really understood the data, right? And she understands pandemics. And so for a while there, when the VP took over the task force and Dr. Birx is there, I watched, and I said, okay, this is good because we now have Dr. Birx and Dr. Fauci at the table who had, robust and healthy dialogue, I thought. And I thought, we have some significant expertise here who is going to help us guide this. But in the end, when you have expertise like that and you have an entire backbone like the CDC, right, who is full of all these experts like Ann Shukat and Nancy Messmer, like all these people who really understand pandemics and who understand what this is and who understand, quarantines, like Marty Citron, who runs a quarantine unit. And they're giving you advice, but that advice is really falling on deaf ears. I think that is what leads to this ultimately big failure because you're not utilizing the system that's there to help you. And I think if you don't incorporate that and you don't allow, things like CDC briefings, which I think were critical. I think that if we would have had more Nancy briefings, like the one that happened in February, where she is very brutally honest, and then you never see Nancy again. I think that having the CDC communicate in the manner which they have in the past, which was traditionally, I think it's critical because I think the public needs to be hearing it from public health experts, right? That's just my personal opinion, because when you add politics to the mix, yes, it's important to have like a leader up there talking about it, but it really should be the public health experts communicating what they need to be communicating in a way that is very factual and unvarnished. And you don't see that. All of that stops. And I think that that's very unfortunate because when you look at other countries, it's really their public health experts that were out in front. Right. And you have, yes, the politics of it, the leaders of these countries come out and some of them, come out in support of it, or some of them back them on these briefings. And you certainly see world leaders today being increasingly more vocal as this pandemic continues. But, in places like Korea, they pretty much stayed out. It was the public health and scientists talking about it. It was the doctors that were out in front. They let them lead the response. And we kind of flipped it on its head and sort of did the opposite.
So let's spend a couple more minutes talking about the CDC then, because I think in previous pandemics, previous instances of public health response, the CDC has been on kind of the bleeding edge. They have been the communication mechanism. They've been setting the messaging, and the politicians, for the most part, have stayed out of the way. Today, it came out that a couple of senior level CDC officials publicly said for the first time that they were pressured around messaging in terms of responding to COVID. Can you speak a little bit about maybe first some of the pressures that the civil service were under? I mean, these are leading epidemiologists, leading scientists. So a bit about the pressures that they were under, and if you have any insight into their thinking kind of throughout the crisis. Of course, a lot of these are really tough things to balance, but why they chose the path they did as opposed to ringing the bell in March and April when things were so bad.
So it takes courage to go on record and go public. So I'm thankful. I know it's Kyle and Amanda who were the chiefs of staffs and deputy chief of staff at the CDC. And I worked very closely with Kyle and Amanda. I probably talked to these people every single day. And I think, for them, it is a big decision to speak out like this. And it comes with repercussions that I think may not always be obvious to just the public, right? I mean, for me, it's hard. I don't know, it's hard because you look at it and you're trying to do what's right behind the scenes. And I'll talk about Kyle and Amanda and what happened there to give a little bit more perspective. And then you walk away from these roles at a certain time for whatever reason. But then, you're also thinking about, will I ever work again? Because when you speak out, there's a certain level of there where you will have people look at you and think, well, how could I trust that person working for me and trust that they're not going to burn me and speak out, right? Like just for any reason. And I think the important thing for going forward in terms of perspective is, this was a moment like none other. I think that I spoke out because this is such a very different circumstance. And I felt like so strongly that this was dangerous for this to continue for our country. And look, I've kept state secrets for almost 20 years, right? I'm a career intelligence officer, like I have a clearance, and I've never done anything like this in my life. But I feel like at some point, you have a responsibility to protect life if that's the role that you're serving in. And knowing that more Americans could get hurt, I think for me was what really mattered. And I chose to do it before the election because I wanted there to be a significant change in the administration for many reasons across the board, right? For public health, for the intelligence community, for our national security, there's a million things. And still today, our own elections and our democracy are being questioned. I mean, so all of these things were reason for me. Now for Kyle and Amanda, CDC went through a very hard time where they were very vocal about what they were seeing and guidelines that they felt needed to be put in place, right? Whether it be mask wearing, whether it be socially distancing, regulations, more regulations in terms of the restaurants and the bars early on in the spring, and early on about, gatherings and slowing the spread that way and getting the information out there that we shouldn't be gathering in large groups if we wanted to get ahead of it. And, they do have a victory. I will say this, that probably makes me think of when we did the 15 days to slow the spread, that we then add 30 days and it becomes 45 days to slow the spread, right? And we saw a decrease in cases during that period. So maybe that is the positive moment, right? Where I had a glimmer of hope that we would get ahead of it. When there was a push from the White House and the CDC and everyone came together, and you had the doctors at the podium saying, this is why it needs to happen. And you had the vice president also in the message saying this needs to happen. We saw the cases and the numbers drop. But then the pressure of the economy and what was happening, and the pressure of honestly, I think being an election year where you had a president who ran a platform of jobs and economy, and they felt very strongly that they had had a lot of success, right or wrong, people all have their different opinions on that. And I think that that becomes the major worry, is that they feel like this is going to really impact that. And so for the CDC, there were many moments where you had such power in the White House over the CDC and what they were trying to say. I mean, to the point where you had people editing their documents. So Kyle and Amanda, they would send documents forward. And it became this thing where there was a rule that was established that said nothing can be published on the CDC website without it going through the White House. That, to my knowledge, has never been done before. I mean, I had that conversation with Kyle where he called me and said, does the White House understand? And he's a political, right? I mean, he was like, does the White House understand how bad this looks? How bad this could possibly look if anybody ever figured out that what is happening here, that it's not right, and we're getting in the way of what the scientists are telling us? And I said, I know. Right? We had that conversation, and I was like, yeah, this is awful. And optically, it would be just as awful if people knew for, the politics behind this. And it's also awful because it's going to impact lives. It's going to, we knew that these guidelines could potentially impact the way businesses were going to use them, the way they were going to be implemented, right? So, I mean, so those are prime examples of the kinds of things that Kyle and Amanda had to navigate. Like, how do you have OMB. Why is OMB involved in this to begin with, honestly? I mean, the last I checked, I'm not trying to be facetious, like Russ Vought, what does he know about science and like medicine or pandemics, right? Like, why is he the final say on a document on whether it goes clearance? And I've sat on these phone calls with them where I had to sit there and negotiate. And at times, I would call the CDC behind the scenes and I'd say, hey, this is what is happening. This is coming your way. And so we got to figure out how we're going to maneuver this through the process in a way that you feel comfortable, that you feel you got enough information out there that's going to protect Americans, knowing that it's going to go through the chopping block, and a bunch of it is going to get like either removed or redacted, right? So, so it's like we're talking about church guidances, because that was critical. We're talking about meat industry and meat packing facilities, where language was changed. We're talking about bars and the number of people. And then what you see happen also is not only is the CDC being pressured and bullied to many ways, where they're not even then allowed to speak publicly, right? And they don't want these daily reports that they would normally publish that are actually so technical that really hospitals are the ones that really need those things. Like, how do you disinfect a mask, or how do you disinfect a gown for COVID in the time of COVID? Basic things like that were scrutinized. Like, if the CDC can't do a basic thing that they've been doing, like some technical document that they've been doing for decades, and post it, and hospitals are waiting and waiting and waiting during a crisis, we've really hurt them and done them a disservice. Does that make sense? And so that is kind of the level of what happened. And I think, that is fundamentally why I think this whole pandemic has been very challenging, because there was no sort of guardrail for sort of politics versus science and health and pandemic response, if that makes sense.
Yeah, absolutely. And and just so people kind of understand as well. So if you're the CDC and you are in these discussions, and all of a sudden, a senior official at the OMB, is making changes to public guidance, what's to prevent you from just ignoring that guidance and publishing it yourself? Like, where does that?
They did.
Sorry.
They did at times. Look,
if they don't have oversight, then why not just push forward, I guess?
So, I think they did. They did at times publish guidances. They at times said that it was a mistake when they published the guidance. I'll give them credit and say that it was someone who was persevering and was like, this needs to get out. And they posted it, and we'll pay for it later, and we'll see what happens. Or maybe they won't notice and people will be able to actually get the information they need. I don't know. I can't speak to that directly, but I know of instances where I witnessed the calls, or I was told to call and ask why the heck is that guidance up, because that's not the language that we had approved. In many instances, I'm going to be honest, I hadn't even seen the guidance. I didn't even know what I was being yelled at about. All I knew was that some guidance was up, and I needed to go call the CDC and ask them why that version was up. And I was like, can we pause for a second? Because I don't even, what version is supposed to be up, and what am I supposed to tell them, right? Like, it's this level of dysfunction. And so I would call, and then, CDC would sometimes, adjust and take it down. And I really think that also comes to who is in charge in the leadership of the CDC. I think that is a critical role, more so than people, I think, really realize, because you really need someone in that seat that is going to protect your agency, that is going to stand up and be your voice in the room when these experts and scientists that are very senior people that are running these different offices, when they're not in the room, if that makes sense. And so I think that it really, and I say this because I have seen people like Dr. Hahn who have remained steadfast. He's the head of the FDA, and he has been critical, in my opinion, to maintaining the integrity of the vaccine approval process, even when bullied, and even when they tried to bully his people at the FDA. He made a conscious decision that he was going to stand up for them no matter what, at whatever cost. And, I think as time goes, I think more of that the truth will come out on everything that happened there and everything he did. And I do think that in the end, he will be seen as, heroic for doing what he had to do. And I hope that, people at the FDA felt very supported, because he did stick to the process and did things unwaveringly. And he and the scientists and the doctors stood strong. And I think with the CDC, you have a very different situation, and where, they had politicals there, people like Kyle, who, in that kind of situation, it's very different because he's dealing with science, right? And it's a job, and he's trying to kind of serve in the administration and kind of trying to support Dr. Redfield. But I think with Kyle, what quickly starts to happen, and I know this because I had the conversations with him, was, I think repeatedly, he is like, what the heck is going on? And this has to stop. Like, what are they doing here? And, you have people like Marta Citron, who was like, the cruise ships should stop sailing today. People will die if people continue to get on the cruise ships. This needs to stop today. In a normal situation, hopefully the CDC would walk into the room and tell the vice president and the president, we had to stop the cruise ships from sailing today. Just stop for now. We got to get these people off these ships. And that happened. But in a normal situation, it would be like, okay. And, because you're erring on the side of public health, right? And so, but I think it's important to think about the fact that there is a whole political lobby out there, and that these lobbies have power and interests and political sway. And, what happens there is, there have been articles about this. And I think I've gone on record on this, where the cruise lobby weighs in, and it's an industry, and they were concerned about the money that they were going to lose and how much money was going to be lost there, and the communities where these cruise ships dock. And the communities were concerned because they're losing the tourist industry there. And so then it becomes a question of, again, like, economics versus public health and public safety and life. And it is, I think it depends on where you're coming from. someone from like me who spends her entire life focused on like responding to mass shootings or terrorist attacks and trying to prevent these things, I'm always going to err on life, right? Because to me, if you don't have life, you don't have an economy. To me, it's like about Americans and making sure that people are safe and then can continue with their livelihoods. But, if we've got a raging pandemic and a virus, none of us are going to win, right? We're not going to have a stable economy and people are going to hurt and they're going to lose their jobs. But I think it's just perspective on where you're coming from. And it's definitely a balance on it. And I only say that because I hope that helps some of the complexity of what sort of starts to happen in this type of situation. And then I think in a political situation like this one, you're going to have to make the call on it.
Yeah. Yeah. And I think another point that you brought up, which I think is quite interesting, is during an absolute crisis like this, heroism can take a lot of different forms. I think individuals like yourself, individuals like Rick Bright, who's a friend as well, we're kind of at the forefront of saying, hey, it's time to blow the whistle. It's time to identify that something is awry here. And there are plenty of other heroes who are operating inside the agency. Fauci comes to mind. Han comes to mind as people who, had to keep the train on the tracks because, hundreds of thousands of lives depend on them. So I think, history is a harsh judge, but, everyone has to figure out what is the best way to support that country. And in the same way that, the public probably would not have benefited if, to the same extent, if you would have stayed quiet and if Rick would have stayed quiet and others, the public also probably would have benefited if, Han and Fauci and others quit, right? So I think there is it's complex, but I think in the not too distant future, it'll start to bifurcate between the people who, were really putting it all on the line, putting their livelihoods on the line, their reputations on the line to make an impact here. So I know we're in maybe the last 5 or 10 minutes, and I want to touch on just a couple other issues. One, the C19 Coalition was really started to help at a time when a lot of the PPE supply chains had just totally atrophied. And originally we were developed as an organization to serve as like the backup to the backup to the backup plan. If federal responses failed, if agencies failed, maybe we could help get PPE into the country or help manufacture it. One question that, constantly came up was, many other countries had opportunities and did purchase huge volumes of PPE, basically just buying out entire manufacturing facilities across China to secure these huge hundreds of millions, billions of items of PPE. We didn't really see that in the US until basically late April, early May. Were there conversations around similar purchases earlier in the pandemic? And if so, why did that never happen?
Yeah, so there was a conversation early. I would say these conversations, some of them were had in February. And I think that, you finally see Project Airbridge get started, right? I guess that was the name of it, where they finally start to fly supplies in. And I think the issue, though, really, I think one of our failures was, we talked about the Defense Production Act, too. So knowing that we were all going to be fighting over this PPE, right? And, these other countries were going to be buying things out, and we were going to be we should have been buying things out back then, right? And doing this. We should have also been turning on manufacturing domestically simultaneously to ensure that would be in place to move forward. And I'll protect the privacy of some individuals, but I will say that there are organizations like the National Association of Manufacturing, NOM, and organizations like that I think had some important proposals and ideas that were brought forward that were never carried through. And I think that is unfortunate. And I think, coalitions like yours And people like that, I hope, will come together, come the new administration, to kind of start to figure that out, because I don't know that we've resolved all the PPE issues still, right? This is going to go on for a while, and it's never ending. And it should also prepare us for future pandemics. But I think, in February, there was also a decision along the way, which is very obvious. The White House struggles with this thing and doesn't necessarily want to own it. And so what you see is they start to push back and they start to make it a state problem. And you'll see this happen with PPE. You see it happen with testing. You see them start to kind of shift and say, tell the governors, you need to be resolving these issues. You need to be taking ownership. And then you have the governors looking at the White House saying, are you kidding me? You're the federal government. Like, in a crisis like this is your role, right? This is your job. Your job is to bring us together and figure out how we're going to do this, and we will carry it out. But we don't even know where to start. Like, we don't even know, what are you guys doing and what are we supposed to be doing? And so wires get crossed in that way. And I think, I think Larry Hogan deserves a lot of credit, because I saw him be very vocal in these meetings where he flat out was like, what do you think what do you expect us to be doing? And this is ludicrous that we are not being supported this way. And then you see him go out and do his own thing because he gives up, and he is trying to just do what's right for his people. And that's when you see sort of this happen. And so I think in terms of PPE, the other thing that I think was difficult was there was a lot of lack of insight into what the hospitals had and didn't have. And I think that that's something that going forward is a lesson learned. We didn't have a way to inventory what was happening, because a lot of this is either private sector chains, private, supply chains. The hospitals have their own channels. CDC does not have a portal where all of this is going in, and hospitals can report nationally, hey, we're out of PPE. Does that make sense? So that was another thing we ran into, was we were acquiring PPE and we didn't know who needed it, where to send it to. And then we had states, our stockpile was depleting, our national stockpile was depleting. And then you also run into an issue of hoarding, where you have actual states fighting for PPE and they're hoarding it for their own state, right? Even though New York is ground zero and they're in a really horrible situation. So you see a culture shift, though. You do see it with ventilators. You start to see the states being like, hey, we don't need them anymore. You guys are the hot spot. We're sending ventilators your way, right? And that's where the governors actually start to come together, and they're fending for themselves and they're doing negotiations themselves outside of the White House or the federal government. But I only get that as examples because there's so many layers to the PPE problem that I think is complex. And so when you have no insight into the ground, on the ground and what's really happening there. And I only say that because I think of Dr. Fauci sitting there saying, you guys are telling me that we're sending PPE to New York. I'm talking to my friends in New York and I'm talking to the ERs and they're saying that they don't have it. And somebody would be like, well, we sent a shipment, blah, 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 yesterday. And Dr. Fauci would get angry in the meeting and he would say, I talked to the head of the ER last night, and he would get very passionate about it. And they don't have masks, and he would get very upset. And so, and I'm sitting there in the room and I'm looking around, I'm like, how is this happening? Why does this keep happening? Right. And so there's clearly the mechanism of the delivery of the PPE and sort of tracking that, that failed. I mean, and I think FEMA coming in many respects was helpful, even though, it was way later. But I think that was critical to kind of bringing some sort of order because they understand the system. They understand, governors know what FEMA is, right? They know to turn to FEMA when there's a disaster. They know there's a system there that exists on how FEMA does things, on how they track things, how they distribute things. And so eventually Pete Gaynor comes in and brings some order into this thing, because then the regional administrators can actually go. They can reach into the region, they can reach into the states, they can kind of start to get and then we start sending the National Guard in to the hospitals to do PPE checks and things like that. I mean, all of that we need to fix, yeah. Right? So that, because it's complicated. And I
No.
think that going forward, those are some of the major challenges we had. And I think that is something. And so, like someone like you, like a coalition IU, I think it's critical that you all exist, because you're right. When things start to break down and there's this failure, we need you. We need organizations like yours to be there as a backstop on the back end to kind of step in, and especially when it's overwhelming on a number of things, right? And so not just PPE, but testing, right? And trying to figure out therapeutics and trying to figure out like vaccines and all of that. And, bringing in hydroxychloroquine from all over the world, even though we weren't going to use it.
Yeah. And I mean, I think, listen, at the end of the day, it does seem that, failures on the response side, they can be put into a few buckets. There's certainly the incompetence bucket, which, has been brimming for a lot of this year. But there's also the complexity bucket. Some of these are not easy problems to solve. For our own efforts, we often hit headwinds with domestic manufacturing, where we had tens, if not hundreds, of manufacturers reach out on a weekly basis saying, we're ready to produce. We have the materials, we have the machines, we just need a buyer, we just need a purchaser. But the prices between international supply and domestic just didn't line up. So some of these are systemic problems that'll have to be addressed over the long term. And, in no way was this going to be an easy problem? Was the pandemic going to be an easy thing, even if everything else was run perfectly? I know we're in the last couple minutes, and I do want to talk a little bit about the future. And as you know, right now, we had Pfizer vaccine approved last Friday. Moderna is likely end of this week. And, this is all in the midst of record cases, hospitalizations, daily deaths. It's a dire picture, but there is a light at the end of the tunnel. If you could, and maybe you are already as well, if you could give recommendations to the people currently on Biden's COVID task force, other officials, what are the things that they should keep front in mind over what we hope is the home stretch here over the next 6 to 9 months?
I think the messaging is key, because I really think that the messaging was a critical piece that really, even the things that could have gone way better, that's where we saw it fail, right? Because when you don't have a consistent message across the board, it's going to create opportunity for counter narratives that are going to be unproductive. And so, it's hard. And I really worry about that for the next couple of months, because I do think that we are unfortunately in a situation in our country where the pandemic has become a politicized issue where people are taking sides on it, right? On like the mask and the mask wearing, right? And that should be just a fundamental thing that everybody should be doing right now. That will really actually help, right? There's been statistical models that have shown the difference of having everyone wear a mask and how far that would go. And so I think, I struggle with figuring out how do you fix the messaging on that. And that is something that I think all of us really need to think about, because I think, whether it's having maybe the medical experts or CDC experts taking the lead again, and it's coming from them. The issue, though, that you have now, right, is that there's going to be a period of rebuilding trust in the CDC, which is really unfortunate, because we really need those voices out there to be trusted. Same with the vaccine, right? There's some people who are worried about the vaccine and the safety of it, because of the way that it's been talked about and handled. And so I think that is fundamentally one of the major things, because I think, fixing the challenges of supply chain, I think that it's going to take work and it's going to take a while, but you can sort of fix that because there's so many lessons learned, and you can kind of go back and say, okay, we just need to figure out in a pandemic who is in charge really in terms of this aspect of it and have it focused. And then kind of decide, and now there's like, we have more data systems in place, right? We have a way where the data is coming in on cases in hospitals that didn't exist. There's platforms like that were built along the way that can be utilized. But I think if you can't communicate with the American public and convince them that this isn't going to get solved overnight, but the sooner we come together on it, the sooner and better off we'll be. I think that is really where we all have to figure out the best way to do that, because the vaccine, it's going to take a while. We know that, right? It's coming out, but it's going to be months before we really have enough plentiful vaccine amounts and doses out there for everyone. So we still have several months to go for people on the front lines, for our healthcare workers, and for all of us to figure this out. And so I think that is where personally I struggle to figure out, how do we all help each other in terms of that aspect? Like, how do you get people to be okay with wearing a mask, and it's not a pro-Trump thing or an anti-Trump thing or a pro-Biden thing, right? How do we get away from that? And I don't know, because I think it's important. It really needs to become more like America against the virus, right? That's really what it kind of should be. And I think we'd be better off.
Messaging. Olivia, thank you so much for joining us today. I felt like we could have had 5 more discussions on any of the single points you brought up, and maybe we will. But regardless, thanks for spending a little bit of time with us, and looking forward to talking again soon.
Thank you. And look, I appreciate your work and the fact that you all come together and you have these town halls. And I think that these are the organizations that give me hope that we'll be okay.